14 ways to prevent heartburn and acid reflux. Millions of people experience acid reflux and heartburn. The most frequently used treatment involves commercial medications, such as omeprazole. However, lifestyle modifications may be effective as well. Simply changing your dietary habits or the way you sleep may significantly reduce your symptoms of heartburn and acid reflux, improving your quality of life. So here are 14 natural ways to reduce your acid reflux and heartburn, all backed by scientific research. 1. Don't overeat. Where the esophagus opens into the stomach, there is a ring-like muscle known as the lower esophageal sphincter. It acts as a valve and is supposed to prevent the acidic contents of the stomach from going up into the esophagus. It naturally opens when you swallow, belch or vomit. Otherwise, it should stay closed. In people with acid reflux, this muscle is weakened or dysfunctional. Acid reflux can also occur when there is too much pressure on the muscle, causing acid to squeeze through the opening. Unsurprisingly, most reflux symptoms take place after a meal. It also seems that larger meals may worsen reflux symptoms. One step that will help minimize acid reflux is to avoid eating large meals. 2. Lose weight. The diaphragm is a muscle located above your stomach. In healthy people, the diaphragm naturally strengthens the lower esophageal sphincter. However, if you have too much belly fat, the pressure in your abdomen may become so high that the lower esophageal sphincter gets pushed upward, away from the diaphragm's support. This condition is known as hiatus hernia. Hiatus hernia is the main reason obese people and pregnant women are at an increased risk of reflux and heartburn. Losing weight should be one of your priorities if you live with acid reflux. 3. Don't move too fast. Avoid vigorous exercise for a couple of hours after eating. An after-dinner stroll is fine, but a more strenuous workout, especially if it involves bending over, can send acid into your esophagus. 4. Limit your alcohol intake. Drinking alcohol may increase the severity of acid reflux and heartburn. It aggravates symptoms by increasing stomach acid, relaxing the lower esophageal sphincter and impairing the ability of the esophagus to clear itself of acid. 5. Don't drink too much coffee. Studies show that coffee temporarily weakens the lower esophageal sphincter, increasing the risk of acid reflux. Whether coffee intake worsens acid reflux may depend on the individual. If coffee gives you heartburn, simply avoid it or limit your intake. 6. Chew gum. A few studies show that chewing gum reduces acidity in the esophagus. These findings indicate that chewing gum, and the associated increase in saliva production, may help clear the esophagus of acid. However, it probably doesn't reduce the reflux itself. 7. Avoid raw onion. One study in people with acid reflux showed that eating a meal containing raw onions significantly increased heartburn, acid reflux and belching compared with an identical meal that didn't contain onion. Raw onions might also irritate the lining of the esophagus, causing worsened heartburn. 8. Limit your intake of carbonated beverages. One observational study found that carbonated soft drinks were associated with increased acid reflux symptoms. Also, controlled studies show that drinking carbonated water or cola temporarily weakens the lower esophageal sphincter, compared to drinking plain water. The main reason is the carbon dioxide gas in carbonated beverages, which causes people to belch more often, an effect that can increase the amount of acid escaping into the esophagus. 9. Don't drink too much citrus juice. The acidity of citrus fruits doesn't appear to be the only factor contributing to these effects. Since citrus juice doesn't weaken the lower esophageal sphincter, but it is likely that some of its constituents irritate the lining of the esophagus. While citrus juice probably doesn't cause acid reflux, it can make your heartburn temporarily worse. 10. Consider eating less chocolate. Patients are sometimes advised to avoid or limit their consumption of chocolate. One study showed that consuming 4 ounces 120 milliliters of chocolate syrup weakened the lower esophageal sphincter. Another controlled study found that drinking a chocolate beverage increased the amount of acid in the esophagus, compared to a placebo. 11. Avoid mint, if needed. Peppermint and spearmint are common herbs used to flavor foods, candy, chewing gum, mouthwash and toothpaste. The study showed that high doses of spearmint may worsen acid reflux symptoms by irritating the inside of the esophagus. If you feel like mint makes your heartburn worse, then avoid it. 12. Elevate the head of your bed. Some people experience reflux symptoms during the night. This may disrupt their sleep quality and make it difficult for them to fall asleep. One study showed that patients who raised the head of their bed had significantly fewer reflux episodes and symptoms, compared to those who slept without any elevation. 13. Don't eat within 3 hours of going to bed. People with acid reflux are generally advised to avoid eating within the 3 hours before they go to sleep. One study showed that having a late evening meal had no effects on acid reflux, compared to having a meal before 7 p.m. Observational studies suggest that eating close to bedtime may worsen acid reflux symptoms at night. 14. Don't sleep on your right side. Several studies show that sleeping on your right side may worsen reflux symptoms at night. The esophagus enters the right side of the stomach. As a result, the lower esophageal sphincter sits above the level of stomach acid when you sleep on your left side. When you lay on your right side, stomach acid covers the lower esophageal sphincter. This increases the risk of acid leaking through it and causing reflux. Obviously, this recommendation may not be practical, since most people change their position while they sleep. Yet resting on your left side might make you more comfortable as you fall asleep. Thanks for your listen.